My name is Charles King. I'm with Nightingale College, and today I'm performing my IV administration video. The very first thing I want to do, or I'm going to do, is receive the order from the physician. And the order today was 150 mLs an hour of fluids, along with amoxicillin piggyback, and I'll go through those my medication math for all of that and the order here in a moment. Before I get into that, I want to talk about my IV tubing identity. So the first portion here is the IV tubing spike. I want to keep this sterile. After that, we have our chamber. This is going to be filled about halfway with fluid. It's also where we're going to be able to visualize our drop rate. This is IV tubing, and then this is my IV clamp, roller clamp, if you want to call it a roller clamp, or just clamp. Pulling it all the way down so it's tight and pinching the tube close to the clamp, rolling it forward, opens it up all the way for max flow. And then if I want to, or when I control the rate, I'm going to adjust the clamp accordingly to control my drop rate. Continuing down the IV tubing, you have your Y tubing or Y port. This is where you would administer any medications such as a piggyback or IV via push, medications via push. And then this is your connector to the IV site. So these would be in a sterile bag, but this has been opened for training purposes. And we'll put it here. So again, I've received an order for administration of IV fluids, 150 mLs an hour. My tubing is 15 drops per minute tubing. And I've done the math here. So my rate of 150 mLs an hour, I put 150 mLs over 60 minutes. My drop rate of 15 GTs per over an ml, that gives me 37.5 drops per minute. And it's very hard to calculate or to do a drop per minute, so we round up to 38 drops a minute. The second order that I received from the physician is for amoxicillin, 250 milligrams in an IV, and that's coming via 100 mLs over 15 minutes. Again, my math is 115 mLs over 15 minutes. Same tubing at 15 drops per minute, and that's going to give me a rate of 100 drops per minute. Okay, so the very first thing is going to be to set up my IV, or well, get everything out of the Pyxis. I'm going to check my once I pull the amoxicillin out of the Pyxis, I'm going to check against the MAR, wash my hands, and don gloves. So I'll do that now. As I walk into the patient's room, I'm also going to shut the door or pull the curtain across for patient privacy. I'm going to verify the patient with 2 patient identifiers, and then also verify the 6 rights of administration, ensuring that I have the right patient, the right medication, the right patient, right medication, right dose, right route, right time, and right documentation. After I've checked my 6 rights, I'm also going to verify that the patient does not have any allergies, especially to amoxicillin, because that's what we're administering today. And then also educate the patient on side effects, or what the amoxicillin is for, and side effects of amoxicillin as well. So I have my IV here, my fluids, and I have my IV tubing. So we're going to go ahead and use the spike to spike the bag. Again, ensuring that this, and then going over the IV bag, I have a medication administration port if I ever need to add to the IV fluid or IV bag, and then I have my spike port. So I'll remove my little rubber top. And again, ensuring that the spike stays sterile. And then using, let me make sure I'm not tangled up. All right, so we're good there. All right, so we're good. I'm gonna uncap my connector so I can prime the tubing. And then open my clamp. All right, so we're fully open. Get the air out of the line. Okay, and I've closed. So let's refill the chamber. Do it one more time. A little bit of air in there still. All right, we're good now. So now I need to calculate my drop rate once I've connected to the patient's IV. The way I'm going to do this is I'm going to know my drop rate from my mouth. I'm going to open the clamp, and then I'm going to count for a full 60 seconds. If I need to adjust it, I'm going to adjust it and then go for another full 60 seconds. Knowing that my drop rate is 38 drops a minute, I'm going to be looking for a little bit faster than a drop every 2 seconds. I'm going to be looking for a drop every second and a half. So I'll have a pretty good visualization as soon as I start, and then once I think I'm in the right area, then I'll start my full minute of counting to verify that I'm at the correct drop rate. All right, so I'm starting now. Okay, so I'm at 42 drops per minute. I would adjust it just ever so slightly to get it down closer to 38 and recount that minute to do it appropriately. Okay, so assuming that ever so little bit of movement at 38 was too much. I really shouldn't have touched it. I'm kidding. Okay, so now I would do the same thing. I would count for a full minute, confirm it's at 38, and then now I need to connect the amoxicillin medication. So we're at 38 drops per minute now. From the adjustment, we counted for a full 60 seconds to confirm it is at 38 drops per minute. Now I need to set up, oh, and also when I hang this, I'm ensuring that it's hung at least 30 inches above the patient's IV administration site for an adult. So now we need to do the medication. So again, verified the correct patient through 2 patient identifiers. we went through the 6 rights of administration. We verified the patient does not have any allergies. And again, going to check this against the MAR before administering, which we've done as well for a second and third time now. And I have my piggyback, same setup. It has a injection port for any additional medication, as well as my spike port. I've got my secondary tubing with a hook, which we're going to use. Let's put that for right there for right now. All right, so I'm going to go ahead and close my clamp. I got my connector, keeping my spike once again sterile. So straight into the spike port. I'm going to fill my chamber halfway. And then we need to prime our line. So what I'm going to do here, hang this while I prime. My cap. And also I'm going to try to lose as little fluid as possible, because this is the medication that the patient is supposed to be receiving. That's actually a really clear line. So I'm going to lose almost no fluid, no medication. Perfect. All right, so our line is prime. I'm going to go ahead and put my cap back on. And then on my IV, this is still flowing at 38 drops per minute. I need to take a alcohol swab and clean my white port, because this is where the medication gets connected. So cleaning with an alcohol swab. I'm going to let that air dry for a moment. So I'm going to go ahead and connect my IV, make sure I have the right one. To my white port. And then my piggyback needs to be higher than my IV solution. So I'm going to have my piggyback up top with my IV bag hanging. And then I'm going to open my amoxicillin at that flow rate of 100 drops a minute. So that's how we would add a piggyback to IV fluids. Piggyback rate again is 100 drops per minute, and our sodium chloride or IV bag, normal saline, is at 38 drops a minute. Being higher, or piggyback being higher, normal saline below, and again, above our patient at 30 inches or greater for an adult. Thank you.